Inside Pediatrics contains real-life surgical scenes in a hospital environment. Viewer discretion is advised. On this episode of Inside Pediatrics.
This was the scariest thing out of this whole procedure.
In the extreme cases, he might not recover.
Her curve has gotten to where non-operative treatment are just not going to work.
I'm scared, but we're finally here to fix something that we've been working on for so many years.
In the middle of America lies one of the busiest independent non-profit children's hospitals in the country. Go inside the operating rooms and the transports. Go inside each family's journey, each patient's story. Go inside Pediatrics at Children's Mercy, Kansas City.
So how many plates will actually be in there?
4 to 6 screws and 2 little rods.
Orthopedic surgeon Dr. Richard Schwend had to wait until Anthony's bones became more mature before he could perform a repair.
You don't want to use that arm.
At the upper cervical spine, his cervical vertebra are real tiny, and so the spinal cord is being squeezed right as it comes out of the base of the brain. And so that area there is real tight, but it's also unstable. So what we have to do is go in and stabilize the spine in the area so it doesn't have unusual motion.
So right now, his neck, he's always like this, but after surgery, his head will be straight up.
Yeah, so what I want to do is just line things up, get your head on straight.
You know, he's 10 years old, and lots of kids just this summer were bouncy houses and water slides, and a lot of those activities he couldn't do because of the restriction of his neck and the risk of paralysis.
I'm scared, but we're finally here to fix something that we've been working on for so many years.
All right,
we'll take good care of you.
Bye, buddy. Love you.
All right, you ready for your ride?
Nine-day-old Tobin Crossfield is recovering from surgery to repair a hole in his diaphragm. But yesterday afternoon, his underdeveloped lungs stopped working, and Tobin plummeted into a crisis.
Yesterday afternoon, he had an event where he went into what's called a pulmonary hypertensive crisis, so we struggled for the next 12 to 18 hours to get him to recover, and we couldn't do it, so he ended up on ECMO.
Definitely one of the worst days of my life, having to go through that. And it was even worse because they tried to call us, but we bounced in and out of service, so we didn't get a phone call. We come over here to thought we were saying goodnight to them, and we come in and they're like, well, we're a couple steps away from having to go to ECMO, and this was the scariest thing out of this whole procedure. This is what I didn't want.
So now it's really just waiting for the hypertensive crisis to subside and him to kind of get back to baseline. Could be a couple days, could be a week, could be a couple weeks. In the extreme cases, he might not recover.
The key is that whatever's causing it has to be a reversible. Otherwise, the ECMO doesn't do any good.
He looks a lot better. Like, yesterday was rough, last night was definitely rough. Being up for over 24 hours and just worrying your mind. And
well, he's riding the circuit now, so
yeah,
keep our fingers crossed, okay, bud?
Yeah, I appreciate it.
Yeah, no problem.
This is Anthony Weaver. No allergies. We're doing a posterior upper cervical decompression procedure time.
4 hours.
Children's Mercy staff often train their peers around the world. The surgeons here see only about 4 cases like Anthony's a year. Because this surgical procedure is rare, it's a great opportunity to share their knowledge with colleagues in Ukraine via telemedicine.
Andre, good morning. How are you? Have you had very many children with occipital fusions and instrumentation? So what we're doing, we're just going to create a small pilot hole. So Andre Dima, right now we're trying to expose the C2-3 fused area.
Anthony's surgery is especially complex due to his abnormal anatomy. Suddenly, one of his blood vessels bursts.
I've been cranking everything up.
Okay.
A pretty good bleeder here.
So, Andre, we've got a big, pretty good-sized bleeder here. We're going to pack it for 5 minutes, see if it stops.
Do you have any aneurysm clips?
Get one?
Yeah, let's get some. Yeah, let's get the aneurysm tray before we try it. I'd get blood in the room.
Back in the operating room, Anthony is losing blood. The team must repair the bleeding artery quickly.
A pretty good bleeder here.
Let me see the dissector.
So, Andre, this looks like it's the vertebral artery that has a hole in it.
The right vertebral artery is a real important artery to the back of the brain. The location was a little bit abnormal.
I feel like, leave it on there for a second. Yeah, that stitch, quick.
What we did was we put a little clamp on it. It slowed the blood flow through that hole enough that we could then put a suture around it.
Okay, Dima, Andre, we put a suture in the vertebral artery on the right, and now it looks like it's repaired. It was just a kind of a weird anatomy.
With the bleeding under control, doctors can concentrate on stabilizing Anthony's spine.
John's putting the left C4 screw in. It's easier from his side. Just put this occipital plate on, and then we got the 6 cervical screws in where the rod is going to go.
Dr. Schwend will replace the deformed upper vertebrae with metal plates and rods.
We're done. They're just getting ready to start closing. Okay. He's doing great. They were able to completely stop that bleeding. Okay. So he's doing perfect. Okay, good. So this was a hard case. He said he has some tricky anatomy.
Which is why he's being followed by so many specialists, because he has so many different things happening in his body.
Right.
Okay, so thank you very much. See you very much. See you in touch.
Okay, bye, you guys. Thank you.
Ellen is a teenager who has adolescent idiopathic scoliosis, and her curve has gotten to the size where non-operative treatment are just not going to work, and she's fairly high risk of continued curve progression. What we're doing today is basically loosening up her spine surgically.
Good morning. How are you guys? See you again.
Good morning.
I feel like I'm going to throw up. I just don't, I don't like them to fall down and scrape their knee, so.
I know she's tough. I'm sure it's going to all work out just wonderfully.
Do you have any questions for me?
Not at this point.
Okay, so I'll see you in there. I'll be with the fluffy hat and the mask on.
Ellie's spinal surgery is expected to take 5 hours. Even though she knows her life will be better when it's all over, she's scared.
Is it a few days of being in the hospital to, if that's what we come out with, and it's going to be that much better for the rest of our life, and I can handle it.
For her scoliotic curvature, the goal is 60 to 80% correction. Gonna go through the skin, and then we basically elevate the muscles away on either side and expose all the bony elements from the top to the bottom. So what I'm doing now is I'm using this bone chisel, and I'm just gonna take some of the joints away. That'll allow us to loosen up the spine. Also, it's a source of bone graft, which is good when you're fusing something. Okay, good.
Halfway through the surgery, Dr. Price confirms the alignment of Ellie's new spine.
That's great. All right, know exactly where we are. Just confirm that with radiology, and it'll be good. Thank you.
Ellie's recovery from spine surgery has been a struggle, but it's going well.
Today's post-op day 3, and she's doing really, really well. So it's really like getting up to a chair 3 times a day now, and she'll also be walking in the halls this afternoon. Hey, Ellie. Did you sleep okay? We're about to get moving, okay? We do a motor function assessment to make sure she doesn't have any numbness or tingling in her extremities. We're making sure her perfusion is good, just because they have a lot of blood loss. So I would say she's doing well. You take the picture.
Got it right over here.
So we're just going to go to the edge of the... And I can pull all the draw sheet.
What do you need me to do?
Okay. You
want me to pull the sheet?
What would be helpful?
I'm going to just keep my knees right here and bring you forward. Okay. Yeah. So push with your legs big and tall, okay? On 3. 1, 2, 3. Push, push. Good job.
Awesome. That's your best one yet.
Great job.
Good job.
Okay. We make sure that they're not bending or twisting. We help them reposition in bed because, you know, they're limited from a pain aspect and just mobility. Okay, so on 3, you're going to sit back and try to get your bottom really far back, okay? All right, 1, 2, 3. Bend your knees, hon. Bend your knees. All right. Okay. Okay, blow out. 1, 2, 3. Blow out, hon.
Blow out.
Slow your breathing.
Does that feel better?
Friday was a long day. We knew, she was in the right hands with Dr. Price and his entire staff, but it's hard to watch your child going through that.
But we know she's going to be better. She's taller than me now, and she wasn't on Friday morning.
She gained 2 inches from the surgery. That's the amount of curvature that there was. Couldn't ask for it to be going any better.
Baby Piper was born with a hole in her diaphragm, and her internal organs have moved to the wrong place. She's been too sick for surgery. But now, Dr. Iqbal feels the time is right to make the repair.
So now we're going to enter the abdominal cavity, what we call the peritoneal cavity. She's missing the diaphragm along the chest wall, starting from about right here, going all the way around to her back. And so she's still going to do well with the muscle flap as opposed to a primary closure. This is our muscle flap here. It now is hanging off of the rib cage. All right, why don't you start reducing? So now Marty's going to reduce all of the herniated viscera that's up in the chest. And for her, that's going to be most of her small bowel, some of her colon, and her stomach, and I think some of her spleen was up there. We'll find out for sure here. Everything wants to go back up, so you get it down and then it slides back up. And so this is probably one of the more difficult parts of the case, is just getting everything down and keeping it down long enough you can get the retractor in to hold it in place.
After nearly 4 hours in surgery, Dr. Iqbal meets with Piper's parents.
So Piper's surgery went very well. Most importantly, her heart and lungs did fine through the operation. When we got in there, we saw that her diaphragmatic defect was what we would expect. It was pretty typical. The muscle flap looked healthy, and the whole defect is covered, and I'm really happy with how her operation went. Now, I do suspect she's going to be on the oscillator for the next day or so, and we're certainly not out of the woods yet. It's going to be really important to see how she does over the next 24, 48 hours, because she could still get sick from just the stress of the operation.
So is there an amount of time when, if ECMO is never on the table for, like, let's just say a week, is it always going to be gone?
I can't say absolutely that there's no possibility she's going to need ECMO. I think it's low, and we should know in the next few days. So the next steps will be getting her weaned off of the ventilator. There's a high likelihood that she's going to need to have a gastrostomy tube or a feeding tube put into the stomach. We'll just have to see how her lungs do. So I'll see you guys tomorrow morning. We'll check in, see how she's doing. Let me know if you need anything else, and we'll be around if you have any other questions.
Appreciate it.
Good morning. All right.
Sweet.
Thank you very much.
Way more positive than we expected. Weird to have anyone in this setting say something about her going home. Or I think we're close to taking a breath that we didn't think we would have at all. So we're pretty excited.
Dr. Schwinn would love to know how much you weigh and how tall you are today.
And he should have gained some weight. We should have, what were we, AJ? 51 pounds before? We got home for the 4th of July, so he was able to see the fireworks that night. Off of his meds within a week, and he's been doing awesome.
48 pounds, 15 ounces.
You've lost. You gotta eat a cheeseburger.
So, Anthony? Hey, guys.
Hello.
Hi, Miss Weaver.
How are you?
Hi, good to see you. Again. Hi, buddy. So Anthony's here at 6 weeks after surgery. He's doing very well. His incision is healing. He's back at school. His head's back on straight now.
I'm actually surprised at how good he's doing. He was off the narcotics within that week. He's moving, he's walking, he's...
Perfect. Didn't we send him home in a wheelchair?
He was on the wheelchair. He hasn't used it.
Doesn't need it, huh?
Doesn't need that.
He's too good for that.
Right.
So the goal is, in the short term, is full sports participation, not having to worry about his neck or thinking about his neck. So there's your x-rays. I don't know if you saw those before.
This is what all you put in?
What is it in my neck?
These things.
Okay, here's these.
Perfect.
All right, AJ, we'll see you, buddy.
Say thanks.
All right. Thanks,
All right,
Mrs.
thank
Weaver.
you.
Okay, thank you very much.
Tobin's parents hoped he would be strong enough to get off ECMO life support quickly. But he's been dependent on the machine for several days. And now, he's taken another bad turn.
Well, he is, but we can't bring the little ones in here, so he's a rest on.
That's right. Look, I know we talked last night, I spoke with Dad last night about possibly trialing off this morning. Our chest x-ray this morning was not reassuring, okay, in the sense that we've lost a little volume in our lungs, okay?
And that's both?
Yeah, both sides, but not, you know, it's just enough that we're not super confident in our challenge today. And the other big issue is that our white blood cell count has changed to suggest that there might be a brewing infection, okay? So we want to wait at least another 24 hours, wait for some of these test results to come back to let us know what we're up against here, okay? We want to get Tobin off of ECMO, but we want to do it, you know, at the right time that's good for him, okay? But as is often the case with ECMO, things are very fluid and they can change kind of quickly. You know, we don't want to push Tobin off if we don't feel that he's ready. I know that's a lot of information, okay? Do you have any questions?
Yes.
No? It's been a long, bumpy road, I know. I'm sorry. I will be in and out, checking on him throughout the day. All right?
Seems like every day it's a new set of challenges that you never know if it's going to be a good outcome or a bad outcome. And it can change in hours.
I've had 3 healthy pregnancies before. Never did I think I would have a sick child. You see it all the time, but you don't ever think it's going to be you.
You would never think that you would wake up every day just hoping and praying that your kid's going to be all right. He's not rolling over easy, so prepared for the worst and always pray for the best. That's the only thing you can do.
Hi, sis. Quacking at us? She's sleeping like this, like Talon did.
I've had a pretty good day. This morning, she got pretty feisty with me at the end of my assessment. So I did give her a bolus of first setting of morphine, and she was great after that.
Cool. Last night we were here late, and she was like wide. It was the craziest thing I've ever seen in my entire life.
She's only for 30 minutes. Just
We haven't seen that at all, so it was crazy.
Nice.
We started this thinking that she would tell us if we're making the right decisions. So I think last night was kind of like a good waking up and looking at Mom and Dad was like, I'm okay. I'll fight for you if you give me help. So you don't want to give too much help and it be too much eventually and feel bad about it. So I think last night was really good for us, for her to say, I'm handling it. Thank you for giving me help. It was a good decision.
Ellie's made great progress in just 4 weeks.
100% different. I mean, after this appointment 4 weeks ago, she had to have a wheelchair to leave. And now she's ridden a bike, walked around World's Fun for an entire day. She swims all the time, lots of shopping. That was our therapy for a while. It's an amazing journey from every day of how much better she is.
She's healing great. She's regaining her motion predictably well. At this point, she's really doing as well as we would hope. So really what we're doing is we're just showing the pre-op x-rays here. And you can kind of see that she's got a fairly big structural curve here. And now we're just going to print that. And then we're going to look at her side views. So she's got a very, very straight spine here. And now she's reconstituted her thoracic kyphosis really quite nicely. Well, we'll go see her, see how she's doing. Oh, hi guys. Well, fancy meeting you here. Hi, how are you? How are you doing? Hey. So it's been a few weeks since we've seen you. How are you? Are things getting back to normal a little bit? Yeah? Are you having any pain issues at all? No. No? Well, let's have you stand up. We'll have a look at you here. All right. I'll just turn you away here so we can look at you. There we go. You look great. Your alignment looks good. Let me have you just bend a little bit this way, a little bit this way.
Dance.
Dance, I'd say...
Starting in August.
I'd say that we just go in and we just test the waters. Okay. You don't realize that there's some limitations, but hey, this is the dancer's operation. So we want you to go back and engage.
Okay, ready? Let's go! And I think back to just 4 weeks ago, and it's crazy how much better she's gotten every day and how she does just normal teenage things, and everyone's pretty amazed.
I'm coming home. On the next episode of Inside Pediatrics.
I don't see a lot of change going on, good or bad.
You can't do, we just met.
I think we kind of walk away from this weekend more impacted than anybody else.
I know he's had a rough course.
Someone said he might be able to hold her.